name is Kristen Clinton. I'm a student physical therapist at Campbell University. Today I'm going to be demonstrating a tibiofemoral anterior glide of the knee. Before I demonstrate, I'm going to review some biomechanics of the knee. The knee is a hinge joint, and right here I have drawn a schematic of the knee. Here is the tibia and here is the femur. So during open chain knee extension, the concave tibia, according to the concave-convex rules, rolls and slides in an anterior direction. Therefore, a tibiofemoral anterior glide will help in improving a patient's knee extension. So now I'm going to demonstrate the technique. This technique can be performed with your patient in prone or in supine. I'm going to start with my patient in prone, and I'm going to take a towel roll and place it under her distal femur. And to perform the glide, I'm going to have one hand around her ankle, and my other hand is going to be at the posterior part of her proximal tibia. So to perform the glide, I'm going to take that hand around her ankle, I'm going to apply a slight distraction, and then with my other hand, I'm going to push down and lateral for the glide. I'm pushing downward to facilitate the tibia going anterior for improving that knee extension. And I'm going lateral because of the screw-home mechanism of the knee, in which the tibia externally rotates 10 degrees in the last 30 degrees of knee extension. Now I can also perform this glide in supine, so if my patient can roll over supine for me. And this time I'm going to place the towel under the patient's proximal tibia. And I'm going to stabilize at the proximal tibia as well. And then I'm going to perform the glide at her distal femur, and I'm going to push in a posterior and medial direction. Glide can also be done with physiologic motion. So if I have my patient bend her knee slightly, and if she can't get her knee fully extended, I'm going to ask her to actively extend her knee and perform the glide while doing so. So bend your knee for me. Now actively straighten your knee. So those are some ways that you can perform a tibiofemoral anterior glide to help improve your patient's knee extension. So in conclusion, according to Kaltenborn, joint glides improve physiologic range of motion and improve functional mobility during activities such as walking. According to Hunt et al. In 2010, anterior tibiofemoral glides improve knee extension during gait in patients that have extension deficits post-ACL reconstruction. Lastly, these joint glides should not be done in isolation. They can be used in conjunction with other treatments to promote lasting changes in a patient. So again, that was an anterior tibiofemoral glide that can be used to improve knee extension in a patient.